The New York Nonprofit Press, the industry standard for nonprofits, is a must-read for over 20,000 New York City and state executives. Those who know the nonprofit world count on the NYNP to deliver breaking news and get messages across into the nonprofit industry. Ads can be placed in our paper, daily emails, or on our website. For more information, visit nynp.biz or email publisher@nynp.biz. The New York Nonprofit Press, serving people who serve people.
Good morning. I'm Allison Brecker, the host of the Nonprofit Voice. I profile inspiring women in our community who give back to others in need and find their purpose in doing so. And my guests this morning are two of the most inspiring women I've ever met. Janice Zaballero, who's the founder and executive director of the Breast Treatment Task Force, BTTF, and Mary Solomon, who runs the ScanVan project, which is a mobile mammography unit for BTTF. But BTTF helps underserved women who are either uninsured, underinsured, or for various reasons can't even get health care insurance or access to health care, meaningful access to health care. And they provide free screening, diagnostics, and treatment for breast cancer, all free of charge. It's incredible. Welcome to the show, Janice and Mary. Thank you so much for being here.
Thank you for having us.
Well, it's a huge population that you're trying to serve, an even bigger undertaking, free treatment, screening, diagnostics, A through Z of breast cancer for this population of women. I'm looking at the two of you, and I'm wondering to myself, how on earth do you do all of this? Tell me about BTTF, Janice.
Well, it's really thanks to Mary. She's been doing this for, 30 years?
Just about.
So about 10 years ago, Mary and I sat down and with some of the other cancer partnership directors, and basically they told me all of the different holes that they were experiencing through their programs.
Okay, so these are gaps in healthcare you're
Exactly.
you're referring to?
Well, and then through the New York State screening program, it's really tough if you're under the age of 40.
And why is that?
Those have been the guidelines forever, right?
Yes, it's a matter of incidence. There's a dramatic leap in incidence once you reach age 40, as opposed to under the age of 40. However, breast cancer is extremely prevalent, and it is not absent under the age of 40. In fact, it is still, I would call, prevalent. 1 in 3,000 women will develop a breast cancer before age 30. 1 in 8 breast cancers that are discovered today will be under the age of 45. By the way, you're going to find nationwide approximately 200,000 women will be diagnosed with an invasive breast cancer and another 60,000 with a non-invasive. That's 260,000 women, and we're saying 1 in 8 are going to be under the age. Let's all do the math.
Right.
It's prevalent.
Just wrap your mind around the statistics. And so, you're speaking about hundreds of thousands of women. Obviously, there's many of them in the New York City tri-state area. And you're you're really targeting your services to the population of women who are uninsured or underinsured. So let's just focus on the health insurance aspect a minute, because I think we need to demystify the Affordable Care Act. I think people generally think that the ACA really filled the void and gave everybody access to health care and basically solved the uninsured problem. Is that true?
No.
And tell me how this group of women has really fallen through the cracks of the ACA.
Well, you can go on the New York State of Health yourself. I mean, you could type it into your computer right now. If you type in, $35,000 a year for income, $38,000 a year, you'll see what comes up. The prices are, $300 a month, $320 a month for health insurance, and that's just the plan. That doesn't cover all of the out-of-pocket expenses.
Right. So these are women who are working, right?
Yes.
They're working in jobs that pay roughly between $25,000, $35,000 a year, Janice.
even up to $40,000 a year, it's tough for them as well.
Right. And even still, I'm not nearly smart enough at this hour of the morning on a Saturday morning, but you know the math better than I do, Janice. But I'm sort of working it out in my own head that's roughly, after taxes, about $2,600 a month.
It's so little.
So little. So figure in rent in the New York City area.
Exactly.
And of course, basic essentials. That really doesn't leave much room for any level of discretionary spending. And I assume that many of these women, especially the younger ones, might view health insurance as a discretionary spend.
They absolutely do. I mean, they need to pay their rent, as you said. They need to eat, so they need to wear somewhat decent clothing to work. So
Right. So
there
these
just
are not
isn't
women
space
looking for a free handout, I think is my point, is that these are women who are working. They're just not earning enough to even cover the basic premiums for health insurance in New York.
Right, and many are working 2 jobs.
Yeah.
There's been a force that has held down numbers of hours worked because small businesses can't afford to pay for ACA. So they've gotten around this by limiting number of hours worked.
Because unless someone works 30 hours a week or more, they're not considered full-time and therefore don't count towards the 50 or more full-time employees for purposes of having to comply with the ACA.
Our ladies have gone out looking for additional jobs just to make that $35,000 a year. They're running ragged. They're going from job to job, and they're trying to take care of their kids in their home. This is really put pressure on this group. We do know that we call this the working poor. In New York, it's very expensive to live here. So
tell me about it.
Yeah. So when we talk about a salary of $35,000, you go and figure. Now you want to add to that the cost of quote health care. This is really cost of well care, because if you include not so well care, diagnostic care, or you need diagnostic testing, this is subject to often a very large deductible, something like $4,000 to $6,000 out of pocket before your plan kicks in. So now you're paying $300 a month for your well care. You go and have your mammogram, and now they tell you might need additional studies, which may include sonograms, biopsy, MRI, any number of things may be needed. This deductible is now in her way, and this is where the BTTF has swooped in and taking care of these women.
Yeah, it's incredible, and we're going to talk a lot about what you exactly do and how you help these women and your business model. My guest this morning is Janice Zaballero, who's the founder and executive director of the Breast Treatment Task Force, and Mary Solomon, who runs the ScanVan project, which I'm so excited to talk about, which is part of the amazing services that BTTF provides. So we're talking about the enormous gap in healthcare that really, I think, has been an underserved and obviously highly vulnerable population. And these are women who do work. They're not looking for a free handout. They just can't afford the premiums for even the most basic level of health insurance, certainly in New York State. And I would assume that many of them probably figure to themselves, well, I'll just pay the $695 penalty for being underinsured if they end up paying that at all because of tax reasons, right? So tell me about, how does BTTF fill the gap? Let's start from initial screening. A woman thinks that she finds a lump or she needs to get a mammogram for various reasons. What does she do, Janice?
Great. So there's 2 different ways. Well, so Mary's screening patients on the van, 5,000 ladies a year. So if they are under the age of 40, or in some boroughs, 40 to 49 is also a tough gap to fill if there's limited funding for the state program. And she'll send those women to us. And then we also have some other community partners that Mary and I both work with, Korean Community Services, American Cancer Society, Asian Initiatives. There's all sorts of sort of specialized groups. And Mary, again, has been doing this even longer than than the BTTF team has, and she knows every single group out there. And so they come in one of two ways. Either Mary or one of our partners has already screened the patient, right? So their mammogram results have come back abnormal. Now they need diagnostic. That's the most common. And then they get referred to BTTF.
Well, let's talk about the ScanVan. For starters, I love the name, but I love even more what you do. You bring the mammography unit to the women who are in need. So, and like you said, Mary, these are women who are running themselves ragged already. They're probably working 2 jobs in many instances. And so not only do they have limited access to healthcare in the sense of not having insurance and knowing where to go, many of them don't know how to get there, don't have time to get there, and don't have time to treat themselves. And I could talk forever about how women tend to put themselves last when it comes to taking care of their own needs over their families. But tell me about the ScanVan. You've brought a picture of it with you. We'll put that up on our website. You really can't miss it. It's a 40-foot colorful van. And so tell me, I know that you're going to be driving around Suffolk County.
Right. So the ScanVan is one of the mobile medical units that is operated by Project Renewal, a very large nonprofit. We are one division of that. We partner with various community organizations throughout New York City, all boroughs, and Suffolk County. We partner with them in that they have a constituency that they look to serve. Perhaps it's for cultural reasons that they band together. It could be for religious reasons that they band together. It could be just interest that brings women together. So these organizations come to us, and we together decide on a date, and we promote that date to bring the van right to their doorsteps. So you might find us in front of your public library, hosted by your local legislator. You might find us in front of your church, hosted by the sisters of that church might come together and bring us in. You might find us in front of your health center, because the directors of the health center find it convenient to refer women right outside their door versus sending them to a hospital center. We're only going to take up 25 minutes of her time. We're going to provide her with a clinical breast exam, which is essential, we feel, to this examination, as well as a mammogram. We're here to screen women. If you are asymptomatic, we want to see you. If you're symptomatic, we want to hear from you. We may not see you on the van. We may be referring you directly to a diagnostic center, one of our partner centers that has agreed to see you at no out-of-pocket charge to you.
Well, we'll talk about the charges in just a second. So if there's women who are listening who want to get your services, or who know other women at risk who might need your services, what do? Do they just hop on the van when they see it driving around their town?
What we want them to do is give us a call. Call 1-800-564-6868 and speak to one of our staff in the office. Tell us what your needs are, and then we may see you on board the van, or we may be plugging you into a partner facility.
And it's so important, especially with early detection. And we'll talk about your own story after the break, Mary. But how else can women find you?
They can take a look at projectrenewal.org, which is a website. Generally speaking, the best way to find us is to give us a call at 1-800-564-6868. The calendar changes almost daily, so I encourage you to give us a call.
And what towns will you be in coming up in the short term?
Very short term, we're going to be located at some public libraries coming up. One would be the Connecticut Public Library on August 22nd, Amityville Public Library on September 1st, Copeg on September 28th. We'll also be at what's called Stony Brook Home, which is a fairly qualified health center, on August 7th in Islip Terrace. We'll also be at a temple on August 7th in Centereach. We will also be visiting the Central Islip Federal Courthouse, which is located right off of Carlton Avenue in Central Islip. We pretty much are
They're everywhere.
We're everywhere.
Well, it's an amazing story. It's an even more incredible service that you offer. My guests this morning are Janice Zaballero, the founder and executive director of Breast Treatment Task Force, and Mary Solomon, who she is the director of the ScanVan project for Project Renewal, which is done in partnership with BTTF. ScanVan is like the name suggests. I just think the name is so clever, but like the name suggests, it's a mobile mammography unit, and you offer free of charge various kinds of screening mechanisms for women who either think that they are at risk for breast cancer. They may have found a lump. They may be scared. They may not know what to do, where to go. And these are women who are not looking for a free handout. They are working. They just can't afford or don't have access to health care. So once they get screened, Janice, and they find that they in fact do have they've tested positive in some way, whether it's a false positive or not, what's the next step for them?
The next step is diagnostic. Almost every patient that has an abnormal mammogram next needs a sonogram, or 2 or 3. So they're sent to one of our private imaging center partner locations. We have about 30 now, which is great. It makes it super convenient for patients. They can go either right by where they work, or they can go right by home. They don't have to spend an hour, commuting somewhere. To get their follow-up done.
I don't know, Janice, how this works, but when I try to see the doctor, sometimes I have to wait like 3 months to get an appointment. How does it work for these women? Some of them might have the BRCA gene or another very aggressive form of breast cancer. So how quickly can they be seen?
We are so lucky. Our ladies are seen sometimes the next day. It's our partners they go to bat for us, right, Mary? It's
right.
Really...
What will happen is the patient will be contacted by one of our patient navigators at the ScanVan office, and the navigator will discuss the results of the screen with her. And if it's determined that she needs further workup, we decide together what would be best for her. We offer her these 30 sites. And what time would you like? What day of the week would you like? We offer Saturday hours, after work hours, because we know our ladies are working. Most of our patients are concluded within 30 days and less. Those that have to go to biopsy may take a little bit longer because there's some pre-testing in a hospital center, but very often we're able to close out these cases within in some days, just a matter of days of the screen.
And so close out, let me be clear, you mean
diagnosed.
So women won't have to live in fear of sometimes the not knowing is the hardest part.
And that's something that women should understand, that first of all, screening is not done every once in a while. It should be done every year starting at age 40. Women should be screened for with mammography. Now, if you are cited with an abnormality, please know that the vast majority of abnormalities turn out to be benign. So we want women to know that finding something does not mean that you're harboring a breast cancer. It means you have something that looks a little different than what would be expected.
Well, for many women, just even getting a mammogram can be very intimidating for them. Some women are self-conscious. They don't want to talk about it. They don't even want to talk about it with their doctor, much less family and friends. So how do you find them, or how do they find you? Why don't you repeat the phone number?
Our number is 800-564-6868. Probably the most effective outreach is your best friend. Clinical outreach happens all the time. Your doctor implores you, please get a mammogram. I saw you for your Pap test, and you said you would get a mammogram last year, and you didn't. Clinical outreach is important, but what we find most effective is your best friend or your sister's hand.
It's such an important point because, of course, we're talking here about women who don't have health insurance and probably haven't seen the doctor in quite some time, and there is no one to remind them. So women really have to look out for each other. Friends need to look out for each other and constantly remind them. We see it on TV all the time with the Revlon Run Walk for Cancer and the Avon Walk, and hopefully that's doing a lot to raise awareness. But if people see your van driving around town, and I'm looking at a picture of it right now, it's hard to miss,
right.
What should they do?
They should step on board or give us a call and make an appointment. It's essential that you be screened for with mammography for breast cancer. It is our best tool in holding down the mortality rate. Women need to understand that breast cancer today is a very curable disease in early stages. It's the latter stage that becomes difficult and more traumatic for patient. Today, screening mammography can uncover early breast cancers, which are easily treated and less traumatic for both patient and family. So we encourage women, please, get your mammogram. If you know someone who's not having her mammogram, please pass on our telephone number, 800-564-6868.
Right. And now health insurance or lack thereof no longer has to be an obstacle thanks to the amazing work that you're doing. My guests this morning are Janice Zaballero, the founder and executive director of Breast Treatment Task Force, and Mary Solomon, who's the director of the ScanVan project, offering free mobile mammograms to communities all over Long Island. After the break, we'll talk more about what your organization does and how you've helped thousands of women in the tri-state area. Thanks for listening, and we'll be right back.
The New York Nonprofit Press, the industry standard for nonprofits, is a must-read for over 20,000 New York City and state executives. Those who know the nonprofit world count on the NYNP to deliver breaking news and get messages across into the nonprofit industry. Ads can be placed in our paper, daily emails, or on our website. For more information, visit nynp.biz or email publisher@nynp.biz. The New York Nonprofit Press, serving people who serve people.
Good morning. I'm Allison Brecker, your host of today's Nonprofit Voice. My guests this morning are Janice Zaballero, the founder and executive director of Breast Treatment Task Force, and we're also speaking with Mary Solomon, who runs the ScanVan project, which is a mobile mammography unit. No more excuses not to get your annual mammogram because she brings the service to you. They have units and vans driving all over Suffolk County this month and in the short term. Welcome to the show. And we were speaking in the first segment about this enormous gap in healthcare, that there are thousands of women in the tri-state area who work. They're not looking for a handout. They work sometimes more than one job. They just don't earn enough to be able to afford health insurance, or in some instances, they just don't have access to health insurance at all. And so we were talking about the ScanVan. It's such, I think this is probably the most important nonprofit voice show I've ever done. And because of the importance of it, why don't you repeat, Mary, how women can get in touch with you if you look out for your friends, if you have not had a mammogram in some time and can't afford health insurance, or you have friends or relatives who are sort of in that same boat. Mary, what could they do to get free mammograms?
You can call us at 1-800-564-6868. We really don't care if you're insured, uninsured, poorly insured. You can always give us a call and know that you'll get a mammogram with no out-of-pocket cost.
It's amazing. No out-of-pocket cost. I mean, there's no more excuses not to get your annual screening. And you're going to be all over Suffolk County in the short term, right, Mary? In Amityville, Central Islip, and some other places?
That's right.
So if you see the colorful van, just hop aboard and make an appointment as well.
That's right.
Right.
That's
so
right.
you really bring the whole concept of healthcare, you bring it it to these women. So tell me, how did you get started with this kind of mobile healthcare idea? I mean, it's very trendy now. We see walk-in clinics all over the place, Stat Healthcare and others. But your mother really started all of this back in the 80s when it was really not a popular thing to be doing.
Quite unpopular, yes.
Yeah. So how did this happen?
It was my grandmother's breast cancer that really rattled my mother's cage. My grandmother was an immigrant and not well educated. Her daughter, on the other hand, was very well educated, a biologist. And my mother literally stumbled on my grandmother's breast cancer. My grandmother was washing out her nightgown in the sink every morning during a visit. My mother asked her, "What's she doing?" And she showed her that she had that bloody discharge from one of her nipples. My mother was completely alarmed. My grandmother said, no, this is just part of growing old. So there was a real lack of education there. My mother took her by the hand, and Grandma was diagnosed with a breast cancer. Gratefully, it was an early breast cancer, and my grandmother lived until she was 93 years old. She died of a stroke, not anything to do with her breast cancer. My mother became really like a dog with a bone. She had to do something. She knew that her mom wasn't the only person out there that didn't know the early signs of breast cancer, went far beyond just a lump in the breast. So she decided to do some research, and she came across the fact that mammography, although very poorly used in the early 80s at the time, was a tool that was terribly underutilized, but it was founded on board a mobile unit in Manhattan. The tests that were done to prove efficacy of mammography happened right here in New York City on board a mobile van operated by the Guttman Institute. Dr. Philip Strax was the founder of that project. Philip Strax was working in New York. She looked him up. She sat down with him. He became really excited that somebody wanted to talk about the project that he ran in the 60s, which actually proved that he could reduce mortality by some 35% if women had annual mammography. This is when mammography was a poor tool. The mechanics of mammography at that time in the 60s was really just in its infancy. So he became excited. He actually offered his services to her. He would be her medical director and develop the protocols and everything that was needed to put a van on the road under one condition. He would do this at no charge as long as she would never turn away a woman in need. Well, that was all my mother needed to hear. Shake of hands, and off she went. She built her van. Actually, with my dad's help, she built a van, put it on the road under the auspices of Dr. Strax, and that was back in 1985. I joined her in January of 87 because things became so hectic. She needed some help. And we together worked on this project, and we built several vans over the years and served thousands of women. And ironically, in 1999, my mother would practice what she preached. She would go on the van every year for her mammogram. And sure enough, her own early breast cancer was discovered on board one of our vans. So this program is truly a lifesaver, not only to thousands of women that I don't even know, but to my own family.
Right. Well, it's such an amazing story about how you obviously found your purpose in starting this whole project. Let's talk about some statistics. And I'm speaking here with Janice Zaballero, the founder and executive director of Breast Treatment Task Force, and Mary Solomon, who runs the ScanVan mobile mammography unit for Project Renewal, which is in partnership with BTTF. Janice, tell me some statistics. How many women in our area have you helped? Maybe you can break it down in recent years.
Oh, sure. Well, we, through the diagnostic program, will see probably about 500 to 600 patients this year.
Okay. And of those hundreds of patients, do you know roughly, whether it's an actual number or just an estimate, how many of them you've been able to catch with early detection?
Yeah, our numbers are high. Last year it was about 1 out of every 50 patients that were diagnosed. Actually, the numbers were trending much lower this year, which maybe that's a good thing. We'll see. But yeah, it's a much higher number that are coming to Mary and I because, right, they're symptomatic. They already know that something is wrong coming to us, so it's a much greater number. So I don't want to scare people out there with something unrealistic.
Right, but I
as
guess
Mary said, the general numbers are much smaller.
Right.
Than that
that's
for
right. So,
diagnosis.
but my point, maybe I should have asked the question differently, is you've been able to basically save women's lives. I mean, but for BTTF and the mobile mammography unit and the services that you're offering free of charge, where would these women otherwise go? They don't have health insurance, or they don't have insurance that covers anything beyond the screening process for breast cancer. So where would they have gone if it wasn't for your service?
Otherwise, they would be sent to a public hospital and they would experience sliding scale payments. But the problem with that is for the population we serve that earn $35,000, $38,000 a year, you would be surprised. I mean, you could still look at $11,000, $12,000, $15,000 worth of hospital bills.
And these are women who then face bankruptcy.
Just a handful of procedures, right, Mary? It's
so this ruins a woman financially as well,
unfortunately.
Right? So so how do you do it? I mean, you're targeting women, thousands of women. It's a huge undertaking who fit in that gap of earnings of roughly $25,000, $35,000, $40,000 a year. These are women who sometimes work more than one job to even do that. They have children in many instances. Maybe they're a single mother running, all the responsibilities that come along with that. And so they sometimes don't get insurance at all, or they'd rather pay the penalty of roughly $700 a year for being uninsured because that's cheaper. So how do you do it, Janice? How do you provide free health care? I mean, let's get into the detail.
Medical partners. It's
Okay,
CP Advanced Imaging. It's Doshi Diagnostics. I mean, these wonderful partners that we have.
So these are doctors and hospitals and other facilities.
Yes, they agree to the discounted prices. So we want to offer these services free of charge to the patients.
So
But
BTTF pays them.
BTTF pays the medical partners the deeply discounted rates.
Well, you have some of these-
$500 for a bilateral
Right, I saw
MRI
on your website,
is amazing.
You have a lot of these rates all written out in your fee
Yes,
schedule.
and they
so-
sign an MOU with us saying this is what we agree upon, and then we pay them every month, every quarter, whatever works for them.
Right, so these are women who have been diagnosed with breast cancer. They are obviously scared, financially scared, emotionally. We'll talk about the assistance that you offer on that end as well, because it's unbelievable. But you provide all of these services absolutely free of charge to these women.
Right.
Incredible. So it's not just the medical services that you offer. My family's been touched by breast cancer. I know very few families who have not been touched by breast cancer in some way. And it's really an overwhelming process, even just understanding and interpreting the results. You offer a navigator service, like a patient advocate for you. Can you tell us a little bit about that?
Well, it's I think the most important part of the program is to provide someone to liaise between the medical people and the patient. It can be a very scary time because you don't understand what it is the doctors are trying to tell you. So our navigators can speak both languages. They can speak doctor speak and they can speak patient speak.
And you also have a need for translators as well.
That's
right?
correct.
So tell us about what your needs are. Maybe there's someone listening who wants to get involved.
We would love to hear from anybody that can speak, for example, Chinese, Korean, Russian, Polish. These are difficult languages for us to navigate. We have Spanish speakers on board the van at all time, but it would be a great deal of help to us and to various communities if we had folks like this at hand all the time. We have some wonderful volunteers, but we're always looking for more.
And where can women go if they want to get involved?
Well, women can give us a call. Our number, again, 800-564-6868. If they want to get involved, please give us a call. We've got work for you.
For young women who might be more technically savvy and have access to, or might prefer to contact you in some other way, how can they do that? Do you have a social media presence? Do you have a website?
Yeah, Project Renewal does have a website. Women can get on projectrenewal.org and send a message to us. Certainly, we take messages all the time looking for, advice or actually looking for exam appointments.
And they can do the same for BTTF. Yeah.
That's wonderful. And so, Janice, tell me about some of your upcoming events. Have you ever turned a woman away who was in need?
Not yet.
Right.
As our numbers keep growing, the self-referrals keep growing. That's what's really interesting to us. We now more than ever, sometimes we're getting 5 calls a day asking for, and those, they found us on Google or what have you. And that keeps increasing. We've been a relatively small program, but now I've been married like the last year and a half. That's shifting.
Right. Well, even though you offer these lower cost services, it's still incredibly expensive. So how do you raise all of these funds and to help with this?
Well, we have Avon sponsors our program for the first time. We'll be working.
You're referring to the Avon Run Walk that's every fall?
Well, the Avon Foundation has a 2-day walk that they do. Actually, Revlon has gone to just an online campaign program, which is interesting. They just started that this year. But then we do a bunch of October promotions. We're very grassroots, but it works well. Like Butterfly Salon in Manhattan, every year they have a special day where they designate all the proceeds towards us. And it may seem, it's a mom and pop shop, but they raised $13,000 in the one day. And all of these accounts, they add up. Magnolia Bakery, $12,000. They're just collecting,
Right. So
as
eat
they're
your
selling the cupcakes. That's
well,
right. Can you donate $1
Right.
to BTTF? But Allison, I'm telling you, at the end of the month, 12,000 plus 12,000 plus another
That's
10,000 plus another 5,000. It really adds up
Well,
and helps
if
all
you-
these ladies.
If you think about it, again, it's way too early in the morning for me to do the math, but if you're offering MRIs at $500 per MRI, obviously $12,000 can go a very long way. And a woman's medical care can make all the difference between life and death for a woman as well as for her family. Right? And you never turn a woman away. So if someone wants to donate either financially or their time, if they're a translator, if you have language skills, especially certain languages, where should women go?
the-BTTF for breast treatment taskforce.org.
Okay, awesome. And for more sort of less technical savvy listeners, who should they call?
They can call Project Renewal ScanVan at 800-564-6868.
Right. Well, this is probably the most important nonprofit voice show I think I've ever done, for sure. You've helped thousands of women. What are some of your upcoming events if people want to go attend or get involved somehow, Janice?
Do you have some that you want to mention as well, Mary?
Well, we screen every day.
Okay, so
Saturdays, Sundays, weekdays, we screen every day.
And you're talking about through the ScanVan.
That's
this
right.
Colorful 40-foot van that you just can't miss will be driving all over Suffolk County. Where will you be in the short term, Mary?
In the short term, we'll be in Islip Terrace, Sandy Reach, Bohemia, Amityville, Copiague, and Central Islip. That is just within now to early October. We are in Manhattan, Queens, Brooklyn, Bronx every week. Staten Island. This is a program that's shared among the boroughs in Suffolk. We've been providing services for many, many years, and we really don't care if you're insured, uninsured, or in between. If you have breasts and you need a screening mammography, please give us a call. If you have an issue or a concern and you need diagnostic care, please give us a call. We may not be able to provide you directly with the diagnostic care, but we can certainly navigate you to a provider that will provide you with that care.
Right, and that's huge. I mean, sometimes it's that it's the mental issue, right? For a lot of these women, I would imagine, I'm putting myself into the shoes of one of these women who's working more than one job in many instances, barely getting by with, the cost of living here in New York, and suddenly she finds out that she might have breast cancer. That's an unbelievably scary proposition for a woman.
Right.
And sometimes it's the fear that just holds them back from getting treatment, ironically.
Right.
So no more excuses, right, Mary?
Right. No more excuses. In fact, the vast majority of findings that women stumble upon are benign, and that's something to keep in mind. Most findings are benign, but it is absolutely essential that women be screened or diagnosed at the very earliest possibility. So if you are 40 years or older and you're not getting an annual mammogram, yikes.
Yeah.
Why not?
And look out for your friends.
Right.
These are women who, sometimes your friends don't even think to ask their doctor,
Right.
if they even go to see their doctor. I think we could talk for hours about how mothers tend to put themselves last in their families and take care of themselves on the back burner.
Right.
So look out for your friends, look out for your relatives, and get them onto the ScanVan.
Right. And may I also say, if you're under the age of 40 and you have a strong family history of breast cancer, if your mother, your sister were diagnosed 10 years younger than you are now, you should start screening. If you have an issue or a concern, if you stumble upon something, please bring it to the attention of your doctor or give us a call so we can help you. Women should be practicing breast self-exam every month. Pick a day about 4 or 5 days after your period. That way your breasts are less tender. Do a vigorous exam. You're looking for consistency. If something feels amiss, it needs to be reported. And give us a call. We can help you diagnose that.
Right. And you give out educational materials as well at the ScanVan, too.
Absolutely. Screening is essential. Clinical breast exams are essential. Breast self-exam is essential. This is a disease that is going to affect in our lifetime. By the time you're 80, the chances of developing a breast cancer are 1 in 9. So it's a prevalent disease. The facts are this is a very curable disease in early stages. So the longer you harbor something, the worse off you are. So bring these things to the attention of either someone on our staff or to your private doctor as soon as possible.
Right. And if you don't have a private doctor, bring it to the attention of a friend or a relative and get them to the ScanVan. There are no more excuses. They're all over your neighborhood all of this month and in the coming weeks. And if Janice, if someone wants to get help, where should they go?
They could also call BTTF as well, 866-515-2883. And we also work with Mary. We have volunteers that can go with patients to appointments. The navigator's obviously coordinating everything, but if they're nervous, we're so lucky. The New York Junior League and some of our other volunteers, they actually go on site with patients and sit with them in the waiting room if they're feeling nervous.
Right. Incredible. So please donate if you're so inclined. Donate your time if you have language skills, especially to help translate medical records or just interpret what the doctors are saying for the patients. But most importantly, get your screening because there's no more excuses. The ScanVan is all over Suffolk County. My guests this morning are Janice Caballero, the founder and executive director of Breast Treatment Task Force, and Mary Solomon of Project Renewal. Thank you so much for listening. Thanks for tuning into the Nonprofit Voice, and we'll see you again next